Hello, my name is Crystal Zamora. I am a student at UTEP, concentrating in education. My patient here is Alvin, and we will be doing an abdominal exam today. Alvin, is it okay if I use you for this video?
Yes.
Okay, so to start off, I'm going to have you lay down on the bed. You could put your head on this pillow, make you comfortable. How are you feeling today, Alvin?
Good.
Okay, good. So first we're checking the patient's demeanor. He's very calm, he's alert, he's not panicked, or he doesn't appear in any pain. So Alvin, we're gonna start off with inspection, which involves me looking at your abdomen, okay? Is it okay if for this exam we lift up your shirt?
Yes.
Okay, I'm gonna be lifting your shirt just up to here. And we're going to start off by looking at his abdomen. I don't see any rashes. I don't see any bruising, no palpitations or pulsations. And I don't see any scarring on his skin or any stray. I am going to touch just to feel the temperature of your skin. It's nice and cool. It's not hot or warm. So your skin is nice and cool. I'm gonna start off by listening. So this will be the first part where I touch your stomach. And I'm also noting that his abdomen is flat. It's not protuberant or distended in any way. So I'm gonna start off by auscultating. I'm gonna listen to your abdomen. We start on the right lower quadrant, move up to the right upper quadrant, then left upper quadrant, then left lower quadrant, okay? And then after I listen to those 4 sounds, I'll let you know what I hear. Okay, so his bowel sounds are normal active, which means they're not slow and they're not fast, so they're normal active. Next, I'm going to be listening for aortic, renal, iliac, and femoral arteries for any bruits, which means that there's turbulence, which would mean there might be a narrowing in those arteries. So I'm going to go ahead and listen to those arteries. We're starting off with I'm going to use my bell for the aortic. Okay, now I'm going to listen to the the renal, sorry. We'll move down to the iliacs. And then the femoral, I'm just gonna go over your shorts, and it's like right above your thighs. Okay, I don't hear any bruise. And the next thing I'm going to be doing, Alvin, is percussing, kind of like how we did for the lungs, but this time it's on the abdomen. And the normal sound that I would hear here is tympani. If I hear any dullness, it might mean that you might have a mass or there could be like constipation. So I'm going to go ahead and listen. And in those 4 quadrants, I did not hear any dullness. It was more tympanic, so that sounds good. Next, what I'm going to do is percuss to feel the size of your liver. So it's going to be in the midclavicular line. I'm going to start here above the umbilicus, and I'm just percussing till I hear the dullness of your liver. So right there, I feel your liver. Now I'm going to kind of mark it, and then so right here, I feel the other dull part of your liver. So I would say your liver size is about 5 centimeters, which is within the normal range. And next, I'm gonna move to the trouse point to see where your spleen is. So that would be in the 10th intercostal. We know you have 12 ribs, so I'm just gonna move down, move up to your 10th intercostal. And I'm gonna percuss there. So I do feel dullness. So now what I'm gonna do is have you take a deep breath in and hold. And now it's tympanic when you inhale. So what that tells me is that you don't have any splenic enlargement. So you could exhale now. And the next thing I'm going to be doing is palpating. So palpating means I'm going to be touching your stomach and feeling for any masses, any tenderness, rigidity. So just let me know if you feel any pain. I'm going to start off with a light palpation and then see how you feel, okay? Okay, and his abdomen is very soft. There's no bumps, no bruises. There's no signs of pain. Did you have any pain? No. Any tenderness when I touched? Okay, so good. So now I'm going to go a little deeper, and this is just to make sure there's no masses deeper in there, and just to check for any pain or distension that you might have. Okay, good. So I don't feel any masses. No, it doesn't look like you're feeling any tenderness. So the next thing I'm gonna be palpating is your liver edge, okay? So that's gonna be like right below your costal margin down here, your lowest ribs. And I'm just gonna kind of put my hands underneath your costal margin, and then you're gonna inhale deep, and I'm gonna feel the liver edge, okay? Okay, ready? Take a deep breath. Yes, I feel the liver edge, and it feels smooth. The liver edge is smooth, and there's no feeling of nodules in that area, so I did feel the liver edge. Next, I'm going to try to feel for the spleen. So for the spleen, I'm going to have him supine, and then after I try to feel it supine, I'm going to have him turn to his right side, and I'll feel for the right lateral decubitus position spleen check. Okay, so we're gonna start off, and I'm kind of gonna look for your bottom ribs right here, and you're just gonna inhale. And okay, I don't feel a spleen there, so now I'm gonna have him turn to the right decubitus lateral position. And then if you could move a little more towards me, Alvin, just a little bit. Thank you. And then I'm gonna just do the same thing, feel here, and then you're gonna take a deep breath. And I don't feel the spleen there, so that is normal. If I were to feel the spleen on that costal margin, it could mean that there might be an enlarged spleen, which could be pretty dangerous. So you don't have an enlarged spleen, Alvin. Go ahead and lay back on your back. Now that I have inspected, palpated, percussed, and palpated, I'm going to check the urinary bladder now that you're facing up again. And I'm just going to check for any distension and tenderness. And it's not distended, which would mean that he would have a full bladder. And do you have any tenderness there?
No.
Okay, so no tenderness. Okay, Alvin, so I'm done checking your urinary bladder. Next, what we're gonna do is I'm gonna check for peritonitis using the rebound tenderness test. So what I'm gonna do is I'm gonna gently press down on your abdomen, and then I'm suddenly gonna let go, and you're just gonna tell me if you experienced any pain, okay? So I'm gonna press down here, and then I'm gonna let go. Did you experience any pain?
No.
Okay, so if he would have experienced pain on the rebound, then that could mean he had some type of peritonitis or appendicitis. Another test that we could use is I'm gonna have you bring this leg up, push against my hand, bringing it up. Do you feel any pain?
No.
Okay. And lastly, what I'm gonna be checking for is costovertebral angle tenderness, which could mean to check for any tenderness of the kidneys. So what I'm gonna do is have you sit up and then give your back to the camera. Thank you. So where we're checking is where the ribs end here. Let me see. So right here is the costovertebral angle, and I'm going to use my fist to percuss. So, any pain? No. Any pain?
No.
No. So no pain on the costovertebral angle, which indicates no kidney pain. Okay, Alvin. Well, you could go ahead and turn around, and that concludes the abdominal exam. Thank you for your time and for helping me do this exam. And thank you for watching this video.